Hey folks, I'm Leigh Brunell, the founder of the Natural Health Clinic, and today we're going to discuss warning signals, 8 physical signs of underlying disease. Stay tuned, we're going to get right into it after this. Welcome back. So this is going to be specifically about what to look for. It's not going to be about how to fix anything, but I think that these warning signs, these warning signals, will be very helpful for many. So the first one is one of the things that many people are very concerned about, and that is the cardiovascular system. Many of you will know some of these signs, but let's just go through them to make sure that you know all of them that can happen. Of course, the most common one that we all know is chest pain, but there can also just be left jaw pain. And so if you are having chronic jaw pain, it's not anything to do with your teeth. That can actually be a warning signal that something is going on within the cardiovascular system. As well as left shoulder, left arm can go all the way down into the hand, and the last 2 fingers especially, the pinky and the ring finger. Being out of breath with very little or no effort, and dizziness. Those are all signs and warning signals of something occurring, possibly occurring within the cardiovascular system. Occasionally with women, they can have right side or right shoulder discomfort as well, not necessarily just left. Keep that in mind. The next one is stroke. Basically, a stroke, the best sign of a stroke is that you start suddenly having a one-sided problem, either just one side of the right side, one side of the left side. It could be that you can't move the jaw, that the muscles suddenly are like, there's paralysis set in, that you can't move the arm well, or you can't move the leg well, or the entire side is just no longer functioning. It could also be that your speech is suddenly affected, along with one of the other symptoms as well. Although if your speech is just suddenly affected, you need to get that checked out as quickly as you possibly can. Infection. Now this is like if you have cold, flu, whatever the case may be. It can be, one of the first signs can be a tingle in the throat. It doesn't even have to be soreness of the throat. A feeling of drainage. Maybe you do have a runny nose. Sneezing, a lot of sneezing chronically throughout the day can be a sure sign that you're coming down with an infection. And even some can have redness of the ears or a feeling of hotness of the ears as well. Fatty liver disease. Non-alcoholic fatty liver disease is unfortunately becoming more and more common. It is mainly because of the SAD diet, the standard American diet that people consume. But signs of this can be tenderness or tightness just below the right rib cage, feelings of fullness without any or very little food, and even pain in the right trapezius as well can be a sign and symptom of liver dysfunction. Gallstones is the next one. Dark urine, very dark urine, extremely brown. Sometimes that can be so dark it almost looks black, but very dark brown urine. Stools that float, whereas maybe you had them, go all the way down into the toilet stool, which is what should happen, but if they're now floating, full of gas, and also constipation. Now, it's not that you've always had these issues, it's that you start seeing these issues developing over a period of time. Kidney stones. Now, most people think that if you have kidney stones, you're going to feel it right in the kidneys here. You may, but it really depends on where you start having issues with the kidney stone. If you feel it in this area here, that's actually within the kidney that you may be feeling it. But as it travels from the kidney in these little tubes that go from the kidney to the bladder called the ureters, you can actually find it in the flank. People call this flank pain, and it can even go down into the lower abdomen as it goes towards your bladder. That can be a sure sign that you have kidney stones and that the kidney may be traveling through that ureter. And of course, if there's any blood associated with that, that can be a sign as well. Next one are ulcers. You may have an ulcer if you find that you have a severe burning pain in the stomach area, which seems to resolve or feel quite a bit better once you eat. That could be a sure sign that you're dealing with an ulcer and you want to get that checked out. Diabetes. How common is this becoming now? So here are signs that your body is heading towards a diabetic, insulin resistance, pre-diabetic situation. You find yourself not able to skip a meal, or if you've been told by a health practitioner that intermittent fasting or fasting at 24 hours would be great for you and you find you just cannot do it, that can be a sign that you have a blood sugar handling dysfunction. Feeling hangry, where if you skip meals, you notice extreme irritation, then you have a meal and you feel much better. Or that you just notice your mood improves after having a meal. You suddenly start feeling more thirsty, or you start urinating more frequently. These are all signs of potential diabetes. So just keep this in mind for yourself, maybe family members as well, and certainly have these things checked out. Now, if you're having any health challenges that you would like a natural approach for, that's why I'm here, so that we can work together one-on-one as a team and find the very best plan and the very best program for your body to attain the goals that you have. If you are interested in having a very customized total health restoration program that we work together to make sure you reach those goals, then I invite you to schedule an initial consultation, and from there we can see if we can help you and exactly how. So thanks for watching. Once again, my name is Labron Ellen. I am the founder of the Natural Health Clinic. And if you would, do me a favor, if you found any of this information helpful, if you think it would be helpful for any of your friends and family, then please like, comment, and share, because that is the only way with these modern day social media algorithms that they will see this information. So it would be a huge favor if you would like, share, and comment on this video. Thanks for watching.